This is Psychological Problems in Adolescence, and we're going to start part one with just some general principles. Thinking about teenagers in the media, an image comes to mind of these drug-seeking, sex-crazed, impulsive, wild youth. This is such an over-exaggeration. We've talked about how the media over-exaggerates things in adolescence so much, but this is an over-exaggeration of problem behavior. The majority of young people move through their adolescent years without any major difficulties, but, it does make for some good drama. There's a really important distinction between like normal or normative temporary difficulties and serious psychosocial problems that are experienced by only a small number of adolescents. So small temporary things could be, but feel big at the time, could be things like a broken heart or a family fight or something like that. When we're thinking about problem behavior during adolescence, it's really important to distinguish, again, between experimentation and then enduring patterns of really deviant, problematic, dangerous, troublesome behavior. During adolescence, it's normal that individuals will, seek independence. We've talked about that a lot and want to be autonomous. But some experimentation can lead to risky or illegal behavior. Nevertheless, there are adolescents who do experiment with these activities, like, let's say, alcohol or shoplifting, that then go on to have drinking problems and criminal careers as adults. But we have to talk about a couple more things. It's important to distinguish between problems that have their origins during adolescence and those that have their roots in earlier periods of development. Most teenagers who have recurrent problems with the law, for example, they also have problems at home and at school from a really early age. A lot of teenagers who report having anxiety or behavioral disorders or mood disorders develop those disorders before adolescence. Just because a problem is displayed during adolescence doesn't mean that it's a problem of adolescence. I kind of skipped around on the bullet points here, but something else in here is that a lot of behavioral problems that are experienced by adolescents actually resolve themselves at the very beginning of adulthood, in that emerging adulthood area. And often that actually is the case with drug and alcohol use or disordered eating or delinquency. Now, all of this being said, adolescence is the most common age for the onset of serious mental illnesses, things like personality disorders or schizophrenia. Problem behaviors during adolescence is virtually never a direct consequence of some sort of normative change that all adolescents go through, right? It's not from that itself. There's really no scientific support that, like, those raging hormones that we've talked about all semester, or maybe like that inherent need to rebel, causes things like oppositional defiance disorder. Rather, hormonal changes from puberty, they do have a modest direct effect on behavior. And when a young person starts to exhibit serious psychosocial problems, that's when it's a sign that, hey, something is off and behavior should be sought out. And that's going to conclude this video.